Hello everyone. Then I'll start. Am I audible and visible? Am I audible? Just let me confirm, then we'll start. Hello everyone. Welcome to Unacademy Future Doctors. I'm myself Dr. Dipti. I'm MD PhD Physiology. I'm Associate Professor and educating MBBS Nursing Physiotherapy, Dental, Homeopathy and MD students. And I have more than 17 years of teaching experience. Now, let me explain in brief about our subscription. We have two kinds of subscriptions. One that is plus subscription. Here you can choose the best from the best. Here you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. Hi, dairy farm, okay. Hello, welcome to my class. You can access Question Bank, which is having more than 25,000 questions. You can compete in the live test and quizzes, and with more than 12 months subscription, you can get printed notes too. Next is Iconic subscription. Here you have access to the best from two of the best, and they are one that is Unacademy and Prep Ladder. With Unacademy, all the features I explained, and second that is Unacademy and Prep Ladder with Prep Ladder, and the features are you can have clinical and integrated essentials, video lectures from the Dream Team, Question Bank 3 with active guidance, system tags, and much more, rapid revision and snapshots and treasures in 2021 Dream Notes. Now, also, we have added certain features in our special class. We made the class interactive by increasing the feature, that is a feature raise a hand. You can talk to your educator in the live class and get your doubts resolved in real time. Tomorrow we'll be having this class in which you can talk to your educator. Okay, so I request you all to go to app and open the window which is having I have my class at 2 p.m. Okay. Also, you can poll for the learner. You can never miss a class as you're always notified for your class. You can get PDF lecture notes and you can access it at anywhere and at any time. We also have updated and highly effective question bank, which is having more than 25,000 high yield questions, which are based on latest exam pattern, and it also include detailed explanation too. These are our NEET PG 2021 toppers. We also have started our Focus FMG 2022 comprehensive batch from 15 December 2021, that is for 6 months, and Target NEET PG 2022 test and discussion batch, that is from 15 December, and that is for 3 months. Also, we have free test on Unacademy Educator curated test series. Here you have to crack 30 questions, and topics are you had already the test was conducted for ENT on 17 Jan. Or for ophthalmology, you will be having your test on 22nd Jan, that is on Sunday, and that is at 12:30 p.m. And for pathology, that is 28 January at 12:30 p.m. Okay, and here we have capped scholarships for the rankers. Rank 1 get 1 year plus subscription plus 5,000 Amazon vouchers. Rank 2 get 6 months plus subscription and 3,000 Amazon vouchers, and rank 3 get 3 months plus subscription plus 2,000 rupees Amazon vouchers. So you can use my code DIPTI10 to unlock this free test. Also, you can subscribe from your mobile, either plus or iconic subscription, and you can use my code DIPTI10 to get extra 10% discount. Okay, now there is also one surprise for you, that you can enroll for the test by going to the app. You can just open the app and you can enroll and you can go on live test. I will just show you the video how you can go to the live test. You can see here. You can see here, this is the code for live test. You can use this code, you can write down this code also. I will just show you again. The code is 4917 and 4. This is the code for my today's exam. You can see here, and minimum 2 candidates are required for going to the live test. You can see here, physiology topic. You can go live and you can get a quiz. You can see here, you can join the quiz. You just get the option join quiz, enter this code 491764 and you can join quiz. Okay, so this way you can join quiz and you can get your knowledge brush up. Okay, now let us start with our topic, today's learning objective, that is physiological anatomy of smooth muscle. Okay, we have completed skeletal muscle, so now today we will start with smooth muscle, one of the other important aspect of the muscle. You can see here, smooth muscle, as we have discussed, 3 types of muscles are there. Skeletal muscle we have already discussed, second are smooth muscles, and third are cardiac muscles. Okay, so smooth muscles, they are also known as plain muscles. Why are they known as plain muscles? Because they have absence of striations. You can see here, striations are present in both skeletal and cardiac muscle but absent in smooth muscles. Okay, these are involuntary. Why involuntary? Not under our control. Okay, suppose intestine, we have smooth muscles. If you have abdominal pain, can you stop intestinal movement? No, we cannot control this activity of smooth muscle. Okay, activity is spontaneous and it is not under somatic nervous system, it is under autonomic nervous system. So it is automatic or under autonomic nervous system control. Okay, nervous system control. Now next is this smooth muscles. They are size and shape, we will discuss. They are small. You can see here, shape is spindle shaped cells, spindle shaped. Okay, or it is known as fusiform shaped, fusiform. Okay, ends are tapering, central part is bulged. Okay, dimensions are different, varies in the dimension. Okay, and these are aggregated to form bundles. Bundles are also known as fasciculi, like skeletal muscle we have discussed. Bundles of skeletal muscle, they form fascicle. Okay, here also bundles of smooth muscle, they form fascicle. Okay, these fascicles here, they are arranged to form layers of various thickness, variable thickness. Okay, and smooth muscles exist either in bundles like this, bundles, or in the sheets. Okay, now next is structure, morphology of smooth muscle cell. Here you can see, this is the cell membrane of smooth muscle cell. Plasma membrane of smooth muscle, that is surrounded by external lamina. Here, this is outside. Okay, and adjacent smooth muscle cells, they are connected by, you can see here, gap junctions. Nucleus, that is either oval or elongated shaped, oval or elongated. Okay, and that is in the center. It is different from skeletal muscle. In the skeletal muscle, nucleus is just beneath the cell membrane. Okay, now sarcoplasm, What is sarcoplasm? That is cytoplasm. Okay. In the sarcoplasm or cytoplasm of smooth muscle, we have mitochondria. Okay. We have Golgi apparatus, all the organelle which are present in other cells. We have endoplasmic reticulum, ribosomes, myofibrils, intermediate filaments. They all are present. You can see here, these are intermediate filaments. These are myofibrils. You can see here, this all. Next is sarcoplasmic reticulum. You can see here, this is sarcoplasmic reticulum. In the smooth muscle, this sarcoplasmic reticulum is poorly developed, not well developed. Okay, it is not well developed. Now, T tubules, like skeletal muscle, T tubules are absent. Okay, and energy which is required for the smooth muscle, it depends on glycolysis. And for glycolysis, there is aerobic and anaerobic glycolysis, that glucose is metabolized. Then next is calmodulin. Cytoplasm, it contains calcium binding protein, and this protein is known as calmodulin. It is similar to troponin in the skeletal muscle. Okay. Troponin is absent in smooth muscle. Very important thing here is troponin is absent in smooth muscle. Instead of that, smooth muscle has got calmodulin. Okay. Now, next is smooth muscle contains relatively less number of thick filaments and more number of thin filaments. Thick filaments are your myosin filaments and thin filaments are actin. So these are less in the smooth muscle. Z line is also not well defined in the smooth muscle. Not well defined. Okay. Then it has got intermediate filaments. You can see here, these are intermediate filaments. Okay. They are present in between this thick and thin filaments. Here are the thick and thin filaments. Here, I'll show you. In this diagram, they are more clear. You can see these are intermediate filaments. Okay. And these are thick, and this is thick, and these are thin filaments. Okay. Now, these intermediate filaments, they provide support to the smooth muscle cell. So that is cytoskeleton. It is a part of cytoskeleton which provides support. Okay. And it has no role in the contraction mainly. Okay. Now, next is myosin. Myosin, you can see here in the skeletal muscle. This is myosin and actin. This myosin and actin here, they are different in the smooth muscle as compared to skeletal muscle. Myosin binds to actin only if the light chain is phosphorylated. Okay. So here you can see light chain phosphorylase is there. Myosin light chain kinase enzyme is there, that is required for the binding. Okay. And thin filaments, these are actin filaments. They are similar to your actin filaments are similar to skeletal muscle, but troponin is absent. Okay. Next is, what is caveoli? This one. There are, you can see here, depressions. Here, depressions are present. Pouch-like invagination. These are known as caveoli. Here there are no T tubules in the smooth muscle. Instead of that, this kind of depressions in which we have, you can see extracellular fluid. In skeletal muscle, you can see here, this was T tubule, which has got extracellular fluid. Okay. But in smooth muscle, there is no T tubule. Instead, this kind of caveoli is there, which has got extracellular fluid. Okay. Now, another difference between smooth muscle and skeletal muscle is this: smooth muscles, they can divide throughout the life, whereas skeletal muscle cannot be divided. Okay, skeletal muscle cannot divide after differentiated. After it gets differentiated, differentiation is complete after birth, and after that it will not be divided. Now, contractile units of the skeletal muscle. Okay, this same as contractile unit in smooth skeletal muscle, that is your sarcomere. Here also sarcomere, but that is not well developed. Okay, here you can see we have small bundles of interlocking. You can see thick and thin filaments. You can see here thick in the center and thin filaments here. This you can see. And they are irregularly arranged, not very much regularly arranged like skeletal muscle. In skeletal muscle, this regular arrangement of these filaments, they give striated appearance. Whereas in smooth muscle, the striations are absent. Okay, and instead of Z line, we have, you can see these are dense bodies. This, okay, dense bodies are present, and these dense bodies, they are attached to cell membrane. Okay, you can see here the cell membrane, they are attached, and these dense bodies are bounded by actinine to actin. You can see these are actin, okay, and actinine, through it is bounded to the actin. Now next is electron microscopic structure of the smooth muscle. Okay, you can see here this is your smooth muscle. As we have discussed, these are dense bodies. Instead of Z lines in the skeletal muscle, here are the dense bodies. Okay, we have this myosin filaments in the center. These are actin filaments here. Okay, this is the cell membrane, sarcolemma. Okay, we have this caveolin depressions instead of T tubules. In these depressions, we have extracellular fluid. Okay, now microscopic structure. Individual myofibrils, they are striated, but these striations are not regular because this actin myosins are not regularly arranged. So this fibers, skeletal smooth muscle fibers, they are non-striated. Okay, the next thing is dense bodies. They are attached to the cell membrane. You can see here these are dense bodies. Okay, and they scatter all over the smooth muscle fiber. Okay, next is actin fibers. This you can see they are attached to dense bodies. These are actin fibers. These are again actin fibers. In the center there are myosin. So actin are attached to dense bodies, and myosin fibers are situated in between this actin fibers. Okay, and when smooth muscle contracts, these dense bodies, they are drawn close to each other. Okay, and therefore the shape of the muscle changes in different way. I will show you. You can see here, this is relaxed smooth muscle, this is contracted. You can see here. Okay, this way the shape of the smooth muscle changes when it gets contracted. Okay, now so contraction of smooth muscle. Now which are the characteristics of contraction of smooth muscle? Smooth muscle contraction, that is of longer duration. It lasts longer, one thing, and less tension is produced. Okay, it is not powerful as skeletal muscle, but it is longer duration. Okay, and it also requires less energy. So you can see low myosin ATPase activity is required for continuous contraction. Okay, and smooth muscles, they have longer actin and myosin filaments. Okay, and low myosin ATPase activity as compared to skeletal muscle. So less amount of energy is required, less tension is there, and long duration of contraction. Okay, now we discuss types of smooth muscle. Mainly we have two types of smooth muscle. This is the important thing: multi-unit smooth muscles and single unit smooth muscles. You can see here These are multi-unit smooth muscles and these are single unit smooth muscles. Okay, now multi-unit smooth muscles. These multi-unit smooth muscles, these are made up of multiple individual fibers. Easy to remember, like we have hostel rooms. Each room has its own kitchen, each room has its own bathroom and all. Okay, same way here, each cell has its own nerve supply and each cell contracts by its own, not dependent on the contraction of the other cell. Okay, am I clear? So here, this multi-unit smooth muscles, they are made up of multiple individual units. As I told you, our hostel rooms, individual units, and there are no interconnecting bridges, no connections between each other, interconnecting bridges. So they act as non-syncytial or not act as single unit. Okay, now this kind of smooth muscles are located where? In which organs we have multi-unit smooth muscle? We have multi-unit smooth muscles in blood vessels, in epididymis of skin, epididymis of male reproductive system, in vas deferens, in iris, not epidermis, piloerector muscle, sorry, it was in iris, in ciliary body, and in piloerector muscle. They all have this kind of multi-unit smooth muscle. Now, so each unit has, as I told you, different nerve supply this way, single nerve supply. Okay. Now, so when there is contraction of muscle fiber by nerve stimulation, okay, and contraction, or you can say stimulation by nerve that releases neurotransmitter either acetylcholine or norepinephrine, and that results in contraction. You can see here individual nerve fiber for each and every muscle fiber, you can see here. Okay, and they do not show spontaneous activity because they don't have pacemaker. So whenever impulse comes, then only there is contraction. Okay, and single stimulus to this nerve fiber cause repeated firing or action potential. So because of that, what happens? The contraction and action potential, that is irregular and tetanic. Okay. Another thing here, another characteristic is there is no connection. Connection is through gap junctions. These gap junctions are absent. Okay. So whatever cell gets stimulated, get excited, that is localized. It will not transmit this action potential to the neighboring cell. Okay. And another characteristic of this multi-unit smooth muscle is they do not respond to stretch. Whenever stretching is there in any of the viscera, single unit smooth muscles, they are stimulated. Okay, they are responding. Okay, how do they respond? I will discuss. Now, next is your single unit smooth muscles. They are also known as syncytial smooth muscles, or they are present in the viscera. So they are known as visceral smooth muscles. Okay, they are also known as unitary. Why? Because 100 to thousands of muscle fibers, they act as single unit. You can see here. Okay, visceral, as they are present in the viscera. Commonly, which viscera they have single unit, you can write down also. Viscera like viscera of digestive tract, GIT, uterus, then ureter, urinary bladder, respiratory tract. All of them, they have single unit smooth muscles. Okay, and also in some of the blood vessels have both the types of smooth muscle fibers, single as well as multi-unit. So blood vessels, they all have single unit smooth muscle fibers. Okay, now these are arranged. How do they arrange? You can see these are single unit, these are multi-unit. So these are arranged in the form of large sheets. You can see here, sheets are there. And they have gap junctions, you can see here, or also known as the low resistance bridges. And they act as single unit. So these are known as syncytial or single unit muscles. Okay. What is the role of these gap junctions or low resistance bridges? They are important for higher conductance of ions. They have higher conductance. What is it? I will explain. Of ions. Ions, they will conduct it, they are going to conduct it from this to this muscle easily. You can see here. So if you are stimulating only this one of the muscle, all the muscles are stimulated. Action potential will spread to all the muscles. Okay. And they have their own myogenic tone. If there is no nerve supply, still they have some kind of muscle tone. Okay, muscle tone means a state of tension in the muscle. In absence of your nerve supply also, there is some tone. Okay. Then, now next is rate of contraction of smooth muscle, that is determined by pacemaker. You can see here there is one area from which impulses are generated, and that is transmitted to all the muscles in case of single unit smooth muscle. So there is a pacemaker here. Okay. And nervous influences, this you can see the nerve fibers here. This nervous influences, they modulate the activity of pacemaker. They can either increase or decrease the pacemaker activity. Okay. And here how they differ from multi-unit. In multi-unit we have discussed stretching produces no active tension. Here stretching produces active tension. Okay. Now whenever there is stretching, there is contraction of single unit smooth muscle. Okay. So contraction of single unit smooth muscle, that is by stretching. Okay. And the muscle present in the small blood vessels, as we have discussed, they are single unit. Okay. So whenever the single unit smooth muscles in the blood vessels, when they are stretched, stretching produces contraction, and that is to regulate the blood flow. Okay. Another, some non-neural stimuli also. Rather than nerve fibers, other stimuli like change in the hormones, change in tissue factor, change in temperature, pH, they all also affect the muscle contraction. Okay. Stretching as well as all these non-neural stimuli, they also affect the smooth muscle contraction. Now, next is different types of smooth muscles in different parts of viscera. Okay, so one, that is circular smooth muscle. You can see here, like circle, like this. The circular smooth muscles, they are present where? They are present in blood vessels. Also, they are present in airways. Here you can see in airways of lungs. In the sphincters, also they are present. And when they contract, what happens? Diameter of blood vessel or airway or sphincter decreases. Okay. Next is circular as well as longitudinal smooth muscle. Both are there. I'll just show you. You can see here, circular, this, and longitudinal, like this, long. Both are there. These are present in intestine. You can see here in the intestine. They are present. Okay. And third variety, they are circular, longitudinal, and oblique. All the three types. You can see here. This oblique layer here. Circular here, this one. Longitudinal and oblique layer. Okay. These three are present. They are present in uterus, in the urinary bladder, okay, and in the stomach. Okay, and here also stretching produces muscle contraction. So this is all about general functional anatomy of skeletal muscle. Now, some questions, answers I will discuss tomorrow. We have tomorrow special class. Tomorrow is 22nd January 22nd. And my special class is at 3 p.m. Okay. Also, we have open class that is at 2 p.m. So you can join both this class by going through app using my code. Okay, so all the answers I am going to discuss tomorrow. Just write down the questions if you wish. Write down the characteristic of smooth muscles. Question number 2, write down about morphology of smooth muscle cell. Question 3, write down characteristic features of sarcomere of smooth muscle. Question 4, what is caveoli? Question 5, can smooth muscle be divided after birth? Question number 6, how contractile units of smooth muscle differ from skeletal muscle? Question 7, write down electron microscopic structure of smooth muscle. Question 8, write down different types of smooth muscles, multi-unit, single unit. Question 9, write down characteristic of multi-unit smooth muscles. And question 10, write down characteristics of single unit smooth muscles. Okay, so these are all the questions from today's topic. Thank you. If you like my video, you can like it, you can share with all your friends, and you can subscribe our channel Unacademy Future Doctors. Thank you.